this is Breast Cancer Awareness Month.
Yes.
And you have a very heart-warm, touching story of a patient who had breast cancer, but she was pregnant and not able to address that at the moment. Can you share that story with everybody?
Yes. This is a case from the university where we had an oncology team and a reconstructive team. Mm-hmm. Commonly, the pattern would be the oncology team would remove a tumor, and then the reconstructive team, almost not knowing really what to expect, would then be called as soon as they were finished, mm-hmm. 6 hours, it could be 10 hours later, mm-hmm. to come in and do the reconstruction or put things back together. This young mother, she was in her mid-20s, mm-hmm. and she had a newborn baby. She turned down chemotherapy and all kinds of other treatments because she had become pregnant. So this cancer really grew, I'm sure, rapidly. While she was pregnant, she was able to deliver a baby. The cancer really involved the entire breast on the left side, and really had also started to occur on the other side, the right side. But it had grown to the skin, and so there were some ulcerations on the skin. And then it had grown inward around the ribs and actually into the lung and surrounding the lung. That, obviously is a very poor prognosis, and it's a very serious situation. At that point, we can try to slow the disease. Through communication with her, we found out that basically she knew she was dying. She had addressed that internally, and she knew that was the situation. And, we asked her, if we were to try to do something for you, what is your wish? What is your dream? Why are what can we do for you to best serve you? Mm-hmm. And basically she said, my wish is to be able to hold my baby against my chest and without an ulceration, without anything hampering that bonding. Anyway, she was evaluated and turned down at a couple places, I think because of the advanced nature of the tumor. Right. And it required a fairly extensive surgery to get off the ulcerations without and take that off. Basically, the surgery involved removing both breasts and part of the actual ribs, exposing the heart, which is just right underneath, because they were really severely involved with tumor. So we by no means were they able to remove all of the tumor, and that really wasn't the expectation, but right. it took the risk of an ulcer really exposing her heart, right, which would be the ultimate disaster. Mm-hmm.
And you're still giving her more life because you're
exactly. So after 7-8 hours of this surgery, that amount of tissue was removed. They called us, the reconstructive team, to come in, and this was I was the director, basically the leader of the team, with a number of residents that helped me do this. So we were faced with the dilemma of covering her heart, basically, and her lungs, and the big opening in her chest, with something, and it's something that's not as simple as just putting a skin graft on. It has to be some tissue that has some bulk, and it has to be some tissue that is alive and has circulation. We call that a flap. And I basically took an idea from something that we do to do breast reconstruction, where we take part of the tummy and leave it attached to a muscle and swing it around to cover that area. Well, the main blood vessels that go into that from the top down were all involved in the removal, so there was no blood coming into the tissue from below, or from the what we call the internal mammary arteries. Basically, what we did is we took the lower 2/3 of the abdominal skin and the fat tissue and just lifted it up, peeled it up off of the muscle wall. And then there are 2 arteries that go into the femoral arteries and veins, large arteries that feed this whole block of tissue. So it was about that wide by that tall. And we took it and just flipped it around 180 degrees. And then the vessels that were feeding it from here were flipped around, and then we found her carotid artery and jugular vein, and plugged it into the side to feed it so it had circulation again. So basically, then that piece of tissue, this is right where her pubic hair was down here, got turned around and flipped up here. And right above where her pubic hair stopped is where we got that skin, so sewed it there, and then sewed it all along here. So basically took off the whole front of the abdomen. Now, the same size defect that was up here now was down here, because we reversed the thing 180. But this is healthy tissue in the lower half of the abdomen where the muscle was. We lifted it off of that muscle layer, and that is safe to put a skin graft on, and it'll take very easily, just as a burn patient or burn victim. So we put a skin graft on that, and we had all of her tummy tissue. In fact, where her belly button was, used to be here, ended up getting flipped around and put up here, and we just put a couple stitches in it to close it up. And belly button was removed. But basically, she ended up with her dying wish. I mean, I think we ended up getting some photographs, and she got to spend time, with that healed up, covering her heart, protecting her heart, holding her baby right next to her, in a rocking chair, and bonding with her. She probably survived about 4 or 5 weeks after the surgery. It's one of those things where you could look and say, well, couldn't those healthcare dollars been used in a better way? But the answer to that is absolutely not.